Hello, good noon. I'm Dr. Sindhu, one of treating doctor here today. Am I talking with Mrs. Seema? Nice to meet you, Mrs. Seema. May I know what brings you here today? You looks quite distressed. Mm-hmm. Okay. Mm-hmm. I'm very sorry to hear about that, Mrs. Seema, and I totally understand that how painful situation would be for you. If it is severe in nature, can I offer you painkiller? Mm-hmm. Are you sure, Mrs. Seema? All right, Mrs. Seema, in order to um, better understand your condition, I need to ask you a few questions. Is that okay with you? Thanks for your cooperation, Mrs. Seema. So, can you tell me since when you have this pain? Mm-hmm. Okay, and where exactly does it hurt? Okay, and does it go anywhere else along with that? Right shoulder? Okay, is it constant or come and goes in episode? May I know nature of pain, if it is burning in type or it's sharp? Mm-hmm. Okay, okay. Mm-hmm. All right, Mrs. Seema, do you have any nausea and vomiting along with that? Any fever? If you record it, fever? Mm-hmm. Okay, have you noticed any sweating along with that? May I know the pattern of fever if it is continuous? Um, okay. And how about your bowel habits, Mrs. Seema? Mm-hmm. Okay. May I know the color of your stool? Okay. And how about your urine, Mrs. Seema? If it is in adequate amount? Okay. If there is any burning while urinating? All right. Uh-huh. What kind of food do you like the most? Okay. Have you experienced any indigestion and flatulence along with that? Okay. If you know your weight or BMI, Mrs. Seema. May I know your weight? All right. Okay, Mrs. Seema. What do you think? What aggravates this pain? Greasy food. And what relieves it? Okay. If you have taken any medicine for this pain, okay. If have you experienced these episodes in past as well? Okay. And so how you managed them? How it resolved in past? Okay. Uh-huh. All right. Any investigation done so far? Okay. Right, Mrs. Seema. I would like to ask you a few personal questions to better understand. Is that okay with you? Thanks for trusting me, Mrs. Seema. Do you smoke? Do you take alcohol? Are you married, Mrs. Seema? Do you have any kids? Okay, how many? Okay, and what was a mode of delivery? Okay, do you have high blood pressure, high blood sugar? Okay, any history of surgery in the past? Any neck related problem? All right, Mrs. Seema, have you noticed any change in your weight? What kind of weather do you like the most? All right, and what do you do for a living? Okay, how's everything at home? Okay, how's your sleep pattern? Okay, all right, Mrs. Seema, if there is any similar complaints of gallbladder stones in family, of any family history of heart problem. Okay, how about your periods, Mrs. Seema? Okay, if they are regular. Okay, okay. All right, Mrs. Seema, if you are taking any medication prescribed by doctor or over the counter, may I know which medicine? Okay. Any other medicine you are taking over the counter? All right. Do you have any drug allergies? All right, Mrs. Seema. In order to reach my diagnosis, I would like to examine you. Is that okay with you? Thanks for your cooperation, Mrs. Seema. Could you please come on the couch? Then I'll sanitize my hands. All right, Mrs. Seema. So I will check your eyes, okay, and your tummy, okay. So please look up, look down, show me your tongue. Okay, and could you please expose your abdomen and below nipples? Okay, and then I'll palpate lightly and then deeply. And then palpate both kidneys, and then I'll palpate abdomen. And Mrs. Seema, I'll press deeply, okay? Then I'll press deeply while patient takes a deep breath to check Murphy's sign. And if it is a positive, then definitely patient will hold his breath due to pain. Thanks for your cooperation, Mrs. Seema. You can cover yourself and come on the chair. Then again, I'll sanitize my hands. Mrs. Seema, the history you have shared and question I have asked, I come to the conclusion that most probably you are having a condition what we call in a medical terminology is cholecystitis. Okay, and there may or may not be, stones in gallbladder. Okay, so for that, Mrs. Seema, I would like to refer you to general surgery emergency right away. Is that okay with you? Yes, Mrs. Seema. They will diagnose, okay, and treat, okay, because if there is any stone, okay, and then they'll decide, okay, if it should be dissolved by medication or with surgery, okay. And if there is any, possibility that there is only inflammation of gallbladder, okay, and then they may recommend antibiotic rather surgery, okay. And Mrs. Seema, along with that, I would like to offer to take, some blood sample, okay. This will save time in emergency department to check signs of inflammation in your body, okay. And along with that, one ultrasound to check for stones or other signs of a problem with your gallbladder. Is that convenient for you? All right, Mrs. Seema. So would you like me to call ambulance? Is anybody accompanying you today? All right, Mrs. Seema, would you like me to inform your family at the emergency department, which is only 20 minutes away? All right, Mrs. Seema. I'm not giving you any painkiller, as this will mask the signs and symptoms for the doctor who will examine you in the emergency. Okay, in emergency, they will give you painkiller and fluids, okay, and if suspected infection, then antibiotics, okay. Yes, Mrs. Seema, there are options like if ultrasound revealed any stone which is less than 5 mm, okay, then they can be resolved by drug called deoxycholic acid, okay, And if there are stones which are more than 5 mm, okay, then they will decide accordingly. And there are options like lithotripsy. In this procedure, sound waves are passed over tummy repeatedly, and this crushes the stones. Okay, no cut is given. Okay, and another is a surgical option as well. Okay, um, and for that you you will require some sedating medication. Okay, called general anesthesia. Okay, so they will decide after ultrasound. Okay. Yes, Mrs. Seema, you need not to be worried. I will continue to take care of you once you are recovered from this. Okay, and I will give written record given at surgery. Okay, you need not to be worried. Okay, is everything clear till now? And once you're recovered, okay, then you can visit me. We will discuss some lifestyle changes like avoiding fried foods and lose weight. And is that clear till now? Is there anything else you'd like to discuss with me today? All right, Mrs. Seema, I wish you a healthy life. Take good care of yourself. Bye bye.